Hello, and welcome to the verbal training session provided to all Med-Scribe employees regarding the New York State HERO Act. Just a quick overview of what the training will entail. We'll start off by talking a little bit about the purpose of the training, and then we'll move into some CDC provided information about the COVID-19 pandemic. Next, we'll talk about the processes that we have in place for employees who have symptoms or exposure. And finally, we'll talk about some site-specific safety precautions. New York Governor Kathy Hochul designated COVID-19 as a highly contagious communicable disease that presents a serious risk of harm to the public health under the New York Health and Essential Rights Act, or the HERO Act, as we'll call it in this presentation. This designation means that all New York employers must activate the workplace safety plans that they have developed under the HERO Act standards. Med-Scribe is required to provide verbal review of our workplace safety plan with all employees. Please note, you may receive training directly from the client that you are currently placed with. All client policies should be followed where applicable. Some workplace-specific policies outlined in this guide will apply only to employees who work internally on-site at 535 Willowbrook Office Park in Fairport, New York. If you are unsure whether this training will apply to you, a good rule of thumb is, do you actually physically report to 535 Willowbrook Office Park? If you do not, there are some sections of this training that will not apply to you, and I will note those as we move into those slides. Additionally, I want to let you know that we have shared the full outline of Med-Scribe's workplace safety plan specific for COVID-19 with everyone who is receiving this training video. If you prefer the document to be provided in a language other than English, please contact us for assistance. Okay, so this first section here is going to revolve around the COVID-19 pandemic information that has been provided by the CDC. Please see the link in the presentation to find this information online as well. Please note the slide will apply to all Med-Scribe staff, not just those working on site at the Willowbrook Office Park. So just some basic information about spread and prevention to start us off. COVID-19 is a dangerous disease caused by a virus. It is very contagious and has quickly spread around the world. COVID-19 most often causes respiratory symptoms that can feel like a cold, a flu, and it can also harm other parts of the body. COVID-19 spreads when an infected person breathes out droplets and very small particles that contain the virus. These droplets and particles can be breathed in by other people or land on their eyes, nose, or mouth. In some circumstances, they may contaminate surfaces they touch. People who are closer than 6 feet from the infected person are most likely to be infected. COVID-19 is spread in 3 main ways. Number 1, breathing in the air when close to an infected person who is exhaling small droplets and particles that contain the virus. Number 2 is having these small droplets and particles that contain the virus land on the eyes, nose, or mouth, especially through splashes and sprays like a cough or a sneeze. Finally, you can also contract COVID by touching your eyes, nose, or mouth with hands that have the virus on them. People with COVID-19 have a wide range of symptoms reported. They can range from mild symptoms all the way up to very severe illness. Symptoms may appear between 2 and 14 days after exposure to the virus. Anyone can have mild to severe symptoms. People with these symptoms may have COVID-19. So these are the symptoms to watch out for: fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or a loss of smell, a sore throat, congestion or a runny nose, nausea or vomiting, and diarrhea. Please note that this list does not include all possible symptoms, merely some of the most common. Okay, next we're going to talk about what to do when you've been exposed or you're experiencing symptoms. It is important for all employees to report suspected COVID-19 symptoms or exposure to Med-Scribe immediately. Med-Scribe is encouraging all staff to receive the COVID-19 vaccination, which has been FDA approved. The Pfizer version is FDA approved currently. Although at this time there is no mandatory requirement for employees, some clients may mandate the vaccine at their individual work sites. Please talk to your recruiter if you want more information about the vaccine policy that might be in place at your work site. Okay, so here are some of the guidelines that we have in place in the event of exposure or symptoms. As a general rule, if you are an employee who works in the field for a client, you will generally follow these guidelines, although if the client has a specific policy in place, that will supersede Med-Scribe's existing policy. So there are two different policies in place. There are policies in place for fully vaccinated staff and also policies in place for staff who are unvaccinated. So we'll start by talking about fully vaccinated employees. So any employee who is fully vaccinated, they must have received 2 shots of either the Moderna or the Pfizer vaccine, or 1 shot of the Johnson & Johnson vaccine, plus have completed a 2-week waiting period after the final shot. Anyone who's not received both shots plus gone through the entire waiting period is considered unvaccinated until that entirety of the session has been completed. So fully vaccinated employees who have been exposed to an individual who has a suspected or confirmed COVID-19 case should be tested between 3 and 5 days after exposure and will be required to wear a face mask for 14 days or until they receive a negative COVID-19 test results. Employees may request time off after exposure, but staying home is not required for fully vaccinated individuals. Some clients may request that vaccinated individuals stay home after exposure according to their own workplace guidelines. Family First Leave is available for COVID-19 related absences available through September 30th of 2021. After that date, you may use accumulated PTO to go towards those absences. Should an employee begin exhibiting symptoms, they should remain home until the negative COVID-19 test is received or a doctor clears them to return to work. Should an employee receive a positive COVID-19 test result, employees will be asked to remain home until a physician or the Department of Health clears them from their quarantine. Employees must have submitted their COVID-19 vaccination card to Med-Scribe to fall under these particular vaccine guidelines. If we do not have proof of your vaccination status, you will be required to follow the guidelines for unvaccinated employees, which we'll touch on in a moment here. Okay, so here are the guidelines for unvaccinated employees. So remember, this includes anyone who has not received any of the vaccine shots or is in process of their vaccine session. So first of all, employees who have had close contact with someone who tested positive for COVID-19 should stay home from work until they receive a negative COVID test. Employees who are exhibiting COVID-19 symptoms should stay home until they receive a negative COVID test as well. Family First Leave is available for COVID-19 related absences through September 30th of this year. Absences that exist after the 30th, you may use accumulated PTO to cover that time off. The CDC recommends being tested immediately upon exposure or exhibiting symptoms, plus testing again after 5 to 7 days. If either test has a positive result, employees will be required to stay home until the Department of Health or a physician clears them to return to work. This final section that we're going to talk about is applicable only for staff who work on site at the Willowbrook Office Park location in Fairport, New York. If you are a field staff member that works at a client site or you work from home 100% of the time, training is now complete and you can shut off this presentation. For all other staff members, please watch this next section just to learn a little bit more about our internal processes that we will be implementing starting on Friday, September the 24th. To keep our staff safe, we are implementing a number of precautions for on-site employees. For full details, including extra explanations, please see the full policy that is attached. So first of all, we are going to be insisting on social distancing while on site at the Willowbrook Office Park. That means that if you are within 6 feet of another staff member, you should back up and try to maintain that 6 feet of distance at all times. That means that the lunchroom, the conference room, and any of the small meeting rooms we have on site should be one person occupancy only. Additionally, we are requiring that masks be worn at any point that you are unable to social distance and really should only be removed when you're sitting at your own workspace and no one is in your 6 feet bubble. Masks are provided. You can find them near the front of the suite, or you can always call Laura for more mask supplies. Generally, in terms of coughing and sneezing etiquette, we are asking that all staff members sneeze or cough into a hand or an elbow and make sure that they're washing hands thoroughly afterwards to try to prevent any exposure. Hand washing, we have a number of hand washing signs posted throughout the suite, but as a general rule, you should sing happy birthday twice to yourself as you're washing your hands. Don't forget to get under your nails and to thoroughly wash both the fronts and backs of your hands with soap and water. When hand washing is not available, please use provided hand sanitizer stations that are throughout the office. We are requesting that all staff who are experiencing any kind of COVID symptoms stay home. You all have work from home setups, so please make use of those if you're feeling under the weather. And finally, we are going to be re-implementing screener questions for all staff members who are working on site. There will be a second training session on how to complete those screener questions, but everyone who reports to work in person should complete those screener questions before entering the suite daily. Thank you for listening. That is it for the COVID-19 specific HERO Act workplace safety training that we are required to provide to all employees. Please contact Laura Malum, administrator at Med-Scribe, with any questions. My contact information is displayed here. Of course, you can always just call the office and ask for me as well. I am happy to take any questions or review any information with anyone on our staff that has questions about COVID-19 or about the safety precautions that we currently have in place to protect our staff. Thank you so much for your time and attention today, and have a great day.